First of all, I would like to thank you for viewing this presentation of the proposed drug interaction database for our hospital. I'm Philip McNamara. As providing quality care requires careful assessment of the patient's current situation and prescribing a comprehensive plan for treatment, this proposed project focuses on the use of a simple database to help our healthcare providers reduce or eliminate errors associated with prescribing multiple drugs that result in our patients experiencing adverse or negative reactions. A recent article written by medical professionals stated that each year approximately 2.2 million U.S. hospital patients experience adverse drug reactions, or ADRs, to prescribed medications. It went on to say that annually 106,000 deaths are attributed to hospital ADRs at a total cost of $12 billion. In our hospital, around 200 patients are affected annually by ADRs, and 19 died last year as a result. According to that study, the national percent of mortality due to ADR is 4.8, with our hospital running double that at 9.5%. This problem is not expected to go away soon, as the CDC has determined that the number of ADR cases will increase due to the development of new medications, discovery of new uses for older medications, an aging American population, the increase in the use of medications for disease prevention, and an increased coverage for prescription medications. The aging U.S. population is at an increased risk of being negatively affected because American patients are prescribed more concurrent drugs as they increase in age. As costly malpractice lawsuits can arise from minor mistakes or professional negligence claims, decision support and tracking systems can help identify potential issues and eliminate these costly mistakes. Prescribing multiple drugs with possible harmful interactions is universally considered to be the fault of the physician, even if another doctor within that healthcare organization prescribed one of the medications. An article from the American Diabetes Association stated that significant drug interactions and patient harm that result from them are common concerns in clinical practice. Another study demonstrated that about 1/3 of all adverse drug events in hospitalized patients can be attributed to preventable drug interactions. The proposed database will help to uncover these potential risks and help our doctors make more informed decisions for a more holistic approach to patient care. It can also benefit our hospital's administration decision-making, as prescribing errors can be targeted and automatically displayed in a user-friendly format. The project would be implemented immediately. As drugs can be prescribed by multiple doctors and administered by even greater numbers of personnel, the database will be accessible to all personnel associated with the process of giving drugs to patients. The database will store general demographic information about the patient, a list of medications the patient has been prescribed to take, all doctors who have prescribed drugs to patients, information on all medications contained in the hospital's pharmacy department, and a comprehensive list of all known drug interactions and their effects. The database will be updated to contain all known drug interactions as stated by the FDA's Adverse Events Reporting System. The project will advance the hospital's knowledge and proactive approach to providing treatment in order to effectively deliver a high level of quality care to all its patients. As time is of the essence during a patient's stay, after a diagnosis is determined, the doctor will be able to quickly assess all available drugs, their side effects, and negative reactions in relation to the patient's current medications. The various hospital departments will also be able to collaborate better during a patient's treatment plan, as they will become interconnected through the database and able to view all relevant medical information. In the future, after more drug interaction research is conducted, the database will be able to accept additional drug interaction determinants such as age, weight, allergies, and even patient-specific genetic codes. Therefore, long-term goals will help to greatly increase our hospital's quality of care provided. As with any new project, risks and issues will be associated with the implementation. As our hospital already has a fully functional EHR, the only initial cost would be the time and effort needed for our clinical systems analyst team to develop the database and train hospital personnel on how to use it. The project's feasibility is very high because the IT infrastructure is already there and only minor improvements would be needed. Change management issues and buy-in from hospital personnel are very low, as the administrative side will reap benefits from the enhanced level of drug prescription monitoring, and the clinical side will benefit from the decision support aspect and ability to provide better patient care. The main risk of reliability would hinge on the proper utilization by hospital personnel and the database's storage of the most accurate and relevant drug interaction data. To keep tabs on unexpected complications from already approved drugs, the U.S. FDA created the Adverse Events Reporting System, which is a database that contains more than 4 million negative events and is updated quarterly to include new reactions as they are uncovered over time by patients, physicians, or drug companies. The risk of technical obsolescence is very low because the project simply stores data in a common database system that will remain operational for decades to come. Once data is stored in any database, it will be controlled and manipulated by the database management system. As the main relational database concepts, such as entities and attributes, are not going to be dramatically changed in the future, the project's relational database model will be adaptable to any new or innovative database management system. Therefore, the project's success is an absolute guarantee. And here we have the proposed database in an Access file. I have already made the relevant tables, as we have patient, a list of our doctors, current medications those patients are taking, along with the dosage and the days they have been taking it, a list of all relevant medications that are contained within our pharmacy department, and all known drug interactions in accordance with the FDA's Adverse Events Reporting System. So I've got some queries. Here's just an example of a query that I've also based reports off of, but this one shows the doctor's name and the patient who he has prescribed negative reactions to. So here Davis prescribed this patient with 2 drugs that negatively interact. Jones, on the other hand, has done really bad and prescribed this one patient with 4 drugs that have 2 negative reactions, and also another patient who has 1 negative interaction. So down to the reports. This is a report of that last query I showed you, and same data, it just is a nice neat form that can be printed out and passed around. Interaction alerts, this would be used for a nurse or administration to figure out exactly which patient is having potential reactions to their medicines. As you can see, the drug 1 and drug 2 and the reactions of Jane Doe. She also has another reaction to her warfarin and Ritalin. And this is a simple form that lists all the patients that have been prescribed medications and what they have been described, with a brief description and the doctor's name who prescribed them. This is another format of the patient meds. It breaks it down differently and gives you more information on the medicines as far as the dosage and whatnot. Again, another report for the administrative side, just a listing of all potential issues they have with specific patients. And this next report is from a nurse side. If a nurse sees a patient having symptoms that are abnormal or not usual, she can go to this report, enter the patient's last name, and I'm putting in Mouse because I gave Mickey Mouse a bunch of issues. And here you can see he is having 2 interactions, one for these 2 drugs and another for these 2 drugs. And that's basically the database so far, as it will be updated to encounter more drug interactions and include a complete patient list as soon as this project gets underway. So again, thank you for watching my video, and I hope to see this project get accepted.